Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, was it last year when we had the May episode come out? Because we were talking about May Day, and Nils made me a little Dutch girl?
Yeah, I think so.
Can we do it again? Yay. So it's May. It's going to be May.
We have the same conversations every time. Beginning of May, what do we always think about? The Kentucky
Derby.
That's right.
Yeah, bourbon.
Yeah.
Yeah, and pralines and all the Kentucky things.
Right. Yes.
What's your favorite Derby Day celebration thing?
Oh, there's so many. There's Kentucky Derby pie, which is really good. There's bourbon balls, which are really good. And then there's like Kentucky, Louisville specific. There's something called a hot brown.
Oh, yeah.
Which is from the
It's a
Brown
sandwich.
Hotel, which is basically if you have any kind of cardiac issues,
It can push you right over the edge.
you're going to have a heart attack. So you do not want to eat that if you take any medications to help your heart. Yeah, there's things like that. But I just love tradition. The South has it way more than we have it out here. It's just the tradition over years and years, and they have marathons. They have a race, a paddle boat race, like big paddle boats, and
Old-timey fun.
oh, they have all that kind of stuff. Yeah.
I'm surprised you didn't bring up like the hats. That to me, like when I think of the Derby, I think of the hats.
No, I wasn't really a hat guy.
And the seersucker.
No.
Got a walking stick.
Yeah, no.
No? Okay, well, no walking stick for you.
I mean, hats are a big deal. Haberdashing.
So instead of being a little Dutch girl, maybe we should be Derby people. Oh, I'm excited for that one.
Yeah, we'll see if we can put a monocle.
I
want a monocle.
You want a
please.
monocle?
Yeah.
I want some Southern charm. Something ruffly.
No problem, Nils.
Yeah.
You guys just added an hour.
Yeah, exactly. Just do Claude AI.
Yeah. Well, you've got the Dutch girl from last year. We can reuse the Dutch girl. All right. Well, what are people here for? They're here to listen to the questions and comments from listeners. This is part 2. If you missed part 1, it will be linked in the description box below. You can also find all of our social media handles here. And if you would like to be featured on the next episode, leave us a text or send us a voicemail at 303-630-9038. Oh, Dr. Martin, we got texts and we got some haterade.
I like haterade.
There's good stuff coming in this video. Yep, there's good stuff coming.
I kind of like the haterade. If it's about my hair, I know it.
Oh, it's not. It's better. All right. Before we get
Is it about my personality?
No.
I know that too.
No.
Okay.
All right. So the first one is a text, and this was an anonymous text. And she did send pictures, but again, as we mentioned in last week's video, please don't send pictures. We are not your doctor. I appreciate that people send them, but we will not be showing them. We will not be analyzing your pictures. This is not medical advice. So she had a breast lift with implants performed last December, along with a 360 tummy tuck muscle repair Mons lift with lipo. Despite the drop and fluff process, my breasts currently have a boxy profile. I have a history of massive weight loss. So she lost 140 pounds. High weight was 260. Current weight is 115.
Wow.
She lost more than half her weight. That is just crazy.
That's insane. How tall is she?
She does not say.
Okay.
My primary surgeon noted that the breast gland was significantly displaced pre-op and suggested that a torsoplasty is necessary to achieve a more rounded shape. I'm planning on an arm and thigh lift within the next year. I would like to know if an extended arm lift reaching into the armpit lateral chest area could effectively address this boxiness by removing excess skin, or if a formal torsoplasty is truly the only solution.
Torsoplasty.
I think she's meaning like a reverse tummy tuck.
Oh, reverse tummy tuck.
Mm-hmm.
Yeah, that's kind of extreme. She's already had a tummy tuck.
She's had a tummy tuck.
Yeah.
Yep.
I would avoid the reverse tummy tuck. I like the idea of doing an extended brachioplasty, which would really definitely help with some of that boxiness that you're experiencing. What happens with weight loss, just so you know, with this much weight loss, your breast becomes very asymmetric. The nipple and areolas become medial or pointing toward the internal. The breast tissue becomes asymmetric, and your breasts get depleted. The problem is in this situation, you had these large breasts, you probably did a breast reduction lift. The only way to get that rounded appearance is actually an implant.
She has an implant.
Yeah, which is hard to convince people sometimes who had large breasts now lost the weight. And then once that implant is in, hopefully over time, the reduction around the implant will kind of round out and you'll have a better result. But
that's what she called the drop and fluff, which I love.
Yeah.
Yep.
Yeah. But that boxy profile would be improved somewhat with an extended brachioplasty, just to kind of get to the chase. Now, some people get a boxy profile because the way that the reduction was done. I have no idea how your reduction was done, so I'm not going to comment on that. Some people can have a boxy profile because they have fat necrosis in the breast reduction itself. And that would be more common with 150-pound weight loss. Your breast soft tissue gets denuded over time with all this loss of tissue, all the loss of the stretching out of the supportive attachments and everything. So you can have something called fat necrosis, which can lead to more of a boxy appearance. And but you would know that those areas would feel hard and kind of distorted, have a distorted sensation. So I doubt that that's what she had.
Yeah. Yeah. And the other thing, and this is like you were alluding to, that people don't necessarily want to hear who are having and she did not say breast reduction. She said a breast lift. Sometimes what you need to really fix this shape is a bigger implant.
Yeah, I was about to get to that. Yeah.
Like to fill the space more.
Yeah.
So, or to pull the skin tighter. And there have been times when we have gone in and revised a lift with implants to do just that, because someone wanted a more augmented appearing breast, meaning very round, right? Like that round, tight breast look.
Yep.
Well, what we do is we go back in, we take even more tissue now that we can, and we put in a bigger implant to push against that skin more, to give that more rounded appearance.
Implants, you don't want them to low ride. You don't want them to sometimes drop and fluff.
Well, you don't want them to bottom out.
Yeah, which
you want them to settle, because then your nipples will point the right direction.
Yeah. But. I just started thinking about low riders. I was like, we could talk about, but then never mind, that was inappropriate. So if you don't want the implants to bottom out, that's what you see that if you go on the internet and you look at pictures after breast augmentation where more than half the implant is below the nipple and areola, it has that real bottomed out appearance. So when you do these lifts and you put the implants in, you really do try to keep the implant higher and wrap the breast around it. But some of the results of that can end up a little bit boxy looking.
Especially if she does have excess skin that extends into the axilla. You can also get that. We had a patient recently complain about like a folded over, look below the breast.
Yeah.
Which then kind of makes the breast look weird because you got this skin that's still hanging over in your armpit. So I think that doing the other surgery she wants to get done first would be what I would recommend. So extending the arm lift, kind of getting, maybe even extending the mastopexy or the breast lift scars to kind of meet up like that T kind of underneath the rib cage. And then if there's still issues, go from there. But addressing your legs and arms is probably a bigger, I would say, priority than fixing the boxiness of the breasts at first.
And this is really the most important salient comment on this whole paragraph that I just read. If you give this the tincture of time, it will work out and it will be less boxy over time, guaranteed.
And that time is like a year.
Yeah, or 2 years.
Yeah.
So giving it some time, if you've lost 150 pounds, which is a miracle, doing the other areas that are of concern, just letting time take its course and see what happens, I think it's probably really smart.
Yeah.
And then you could go back in and, as Amy said, do a bigger implant, something that's more projecting, kind of revise that mastopexy. There is some technical things I'm assuming happened that probably could have had a better outcome, but then even then you probably still have somewhat of a boxy appearance.
Yeah, it's so hard to tell.
Yeah.
All right. Well, so thank you so much. I wish you'd told us your name, but either way, we appreciate the text.
Yeah.
All right. Next one is also a text, and this was also anonymous. So when you text, you can tell me your name, and you can tell me you don't want to say it. That's totally fine. So if you don't want your name said, that's also fine.
Yeah.
It says, hello, I'm looking into a lower body lift and just came across your Beauty and the Surgeon podcast, episode 144. I had gastric sleeve surgery in July of 2020 and lost 300 pounds the first year.
Wow.
And have maintained the weight loss to date. So he has maintained a 300-pound weight loss for 4 years.
Crazy.
I know. I was blown away.
Yeah.
I have recently had an emergency hernia surgery with bowel obstruction. No bowels were taken out, which is great because you don't have a lot to go when you've had, with a sleeve, you've already had some taken.
Yeah.
No mesh used for repair. I had umbilical hernia surgery in 2011 with mesh used. My question is, how much more difficult will the abdominoplasty portion of the body lift be with the old mesh in the stomach area?
Should not be. It'll be more difficult, but it should not be that difficult. But then we actually had a similar question on the last episode. It depends on what the scar was, what they used. So if they did a long kind of ventral scar, it's in the midline, it's probably would still work because you may already be a candidate for a fleur-de-lis. We've had a question like this.
Is he would be.
Yeah, we've had a question like this where they were asking if you can do a circumferential body lift and a fleur-de-lis tummy tuck. We had that question.
Yeah, that was a...
and you can. That's a lot of surgery, but you can do it.
Definite maybe.
Yeah, but you could do it. So I don't think it would preclude you from doing a tummy tuck. Now, if you had an active hernia there and that hernia was difficult to repair, and you would have to do some surgery called like separation of components, where you have to take the muscle and separate and bring it over. Yeah, doing a tummy tuck at that time might be a little bit extreme. But if you're talking about a stable hernia that's been repaired, you had no bowel issues, you have a little bit of mesh there, it's not a big deal. Yeah, I think you could do a tummy tuck at the same time.
Yeah, and seriously, congratulations. I mean, I can't even imagine how that would feel. I mean, in a year to lose, I mean, if you lose 100 pounds in a year, that's remarkable. But 300 pounds in 1 year?
Yeah.
I mean, it's
really interesting. These people always tend to get hernias from the port sites,
yeah, which would be my assumption.
From the gastric sleeve.
Yeah. Well, because it's just,
I wonder, but do you think that bariatric surgeons talk to the patients about that very often?
I hope so.
Yeah.
I mean, yeah, so they should, because you need to be aware of that possibility.
That's a common presentation.
Yeah, there's so much education for patients that are having bariatric surgery. Like, I feel like that should be something that they discuss, but yeah.
Dr. Metz would talk
He
about
would know.
it.
Dr. Metz would know.
Our guy, Dr. Metz.
So Anonymous,
That's OG.
Thank you so much for the text. Good luck with your body lift, and yeah.
300 pounds, man.
It's incredible. Incredible. All right. So this one came from Susan Sella 2526. Everything you need to know about facelifts, part 1. She said, I think a lip lift can really change an appearance. What do you think, Dr. Martin?
I think it can, in a good way and a bad way.
Any surgery can change your appearance.
No, but like, it's such a small amount of skin and soft tissue you're removing for the lip lift. So just to go back, we don't actually have an episode on lip lift alone. Maybe we'll do that in the future. It puts an incision at the base of your nose around your ala.
I think we do have a lip lift episode, don't we, Nels?
I don't think we do. No, we don't.
We've talked a lot about it.
We've talked about it. We just don't have. We don't have a specific. Might be good to do one. Yeah. And then kind of at the base of your nostril, and then around this kind of central part of your nose, which is called the columella, and you do it on both sides. You lift up the skin, which everts your upper lip. The vermilion, wet and dry, kind of rotates it out, giving you more, what appears more fullness to your lip. And then in some cases, which is needed, it'll kind of give you some incisor show of your teeth, which normally in repose, in a normal sitting position, you can kind of see the edge of your incisors. You should. What happens with age is it gets really long. So actually a lip lift can be amazingly beneficial. Mm-hmm. But if you start doing super aggressive lip lifts, just like anything else, yeah, you can really change your appearance. And I've seen that too, and it doesn't look good.
Well, and that's why I said any surgery can change an appearance. I had this conversation with someone just yesterday who was thinking that their nasolabial folds would be completely effaced and gone with a facelift. I'm like, they absolutely wouldn't. And if they were, you would look like this. And I pulled like this. Like, this is what you would look like.
I think you look really good like that, Amy.
Right?
You should definitely do that.
It'd be a real bad look. So at a rhinoplasty, I mean, even something like an otoplasty can fundamentally change the way a person looks.
Ear pinning procedure.
Yeah. I mean, in our world, the best surgery, I always say, is the one that no one notices, because you just look like yourself. Like, you just look better.
So that's something else I want to say. Amy and I have, in our practice, we have a very natural aesthetic. We are very body positive. We want people to love themselves for who they are. And these surgeries we offer just gets rid of little things they don't like, but they remain looking like themselves.
Resets things. It's not even things that people don't like. It just resets it to how it
was. Transforms,
Mm-hmm.
whatever word you want to use. But like, at its baseline, it honors who you are. And so you can do a lip lift that does that. You can also do a lip lift that's extreme, and some people like that, and that's their right. And if that's what they want and that's what they get.
Yeah, look at how odd people's appearance changes with lip filler.
Yeah. So I'm torn on that, because if that's what the person wants, they discuss the risk and benefits. They show the surgeon, that's what I want. They showed him in a picture, and it was just like that. I mean, it's their right to do it.
It's like going into the hairstylist, telling them we want bangs.
Amy gets the points. We do have lip lifts and augmentation.
I knew I'd written that episode.
138. Yeah.
138.
I totally forgot.
That's
about
crazy.
No, I was like, I know I've written a lip lift episode.
Yeah, I was like,
but it stands to be redone.
I feel like this is the Mandela effect. I don't think we did the episode, but we all think we did.
No.
Yeah, it's a little ways back, 138, but still, that's still a...
Thanks to the beauty of the internet, there is proof that we did that episode.
Here, this is the episode.
There it is.
There you go.
Yeah. All right, Susan, that's a great comment. Thank you. All right, next one. Still on everything you need to know about facelifts, part 1. This is from Margaret NG2491. Do you need to go on a special diet before and after a deep plane facelift? Example, low sodium, protein diet before and after surgery. So, Margaret, we have 2 great episodes that talk about supplementation around surgery, and we do touch on diet in those episodes. Something I highly recommend that people do not do is manipulate their sodium intake around the time of surgery, because that can have, as we talked about, and this was another question from someone, this can have negative effects on your electrolyte levels.
You could end up in the hospital.
Yeah. It could be very
with
bad.
like swelling on your brain.
Yeah, like you need salt.
Yeah.
Like people think they need to cut sodium from their diet because it affects swelling. Well,
Because you're going to get hyperhydrated
Yeah.
during surgery, and then you cut your sodium. So you're going to become sodium deficient, conceivably.
and maybe you're not eating, and now your potassium levels are all thrown
Yeah.
off.
And you might be drinking a lot, but
Yeah.
you're not eating.
Yeah.
So then you can become water toxic. I mean, it can happen.
Yeah.
We've never had a patient do that.
Hyperkalemia is real.
Yeah.
Yeah. So
Hyponatremia would be that scenario, but you could have hypernatremia.
mhm.
You could have too much sodium. That's dehydration. So there's so many different things that could occur.
Yeah.
I think definitely doing normal salt intake is
Yes.
probably appropriate.
That's what I mean. You should just keep your salt intake consistent.
What about protein? Would you say elevating?
Well,
your
I'm going to
protein?
bring up one other thing with the sodium intake, because Dr. Martin recently had this happen with a patient who was consuming a lot of Element, which we love Element, but was consuming a lot of it after surgery and was very swollen.
Was she like snorting it, or?
Yeah. So, my electrolytes are great. Sodium is great. However, I do not recommend making drastic changes to your diet for elective surgery. You should be healthy enough for surgery going in. Okay. Let's put that as a baseline. But your diet after surgery should be a very healthful diet. And a lot of times, especially after a facelift, people don't feel like chewing a lot, right? Your mouth feels kind of tight. The muscles are tight because we made them tight. So making sure you get an adequate intake of things like protein is very important. It's also important not to go on a reduced calorie diet after surgery, because you're not going to heal as well.
Would you increase your protein intake?
Well, for a normal healthy person, their protein intake should be adequate prior to surgery. Now, if someone is not consuming enough protein, I would definitely want to optimize their protein intake before and after surgery for healing. So also including a lot of like fresh fruits and vegetables. So you're getting a lot of those building blocks that your body needs. Like we talk
And
a
the
lot
fiber
about vitamin
for,
C.
yeah.
Yeah, fiber to go to the bathroom. But really my big things after surgery, and I think I say this in our supplementation around surgery episodes, is that you want to make sure you're getting an adequate calorie intake. You're not necessarily going to feel like eating with a facelift specifically because of the chewing component, but also if you're taking pain medication, you're also not doing a lot. So your body's not maybe giving you the cues that you need to be eating. So people are like, oh, I'm not doing anything, I should just not eat. Like, nope. So keeping a very healthful, balanced diet and not manipulating your sodium intake one way or the other would be my recommendations.
Okay.
Broad recommendations.
So you're not going to give milligrams per kilograms of protein?
No, I'm not. Nope. Because that's not appropriate, because you're not my patient. So, but it's a great question.
Because I want to know for me. That's all I was going to say.
You
All
work with a coach who tells you what you should eat. So you should be
right.
following your coach's instructions.
That's a good point.
Yes. You work with an expert.
If someone's vegetarian, is that like something that they need to adjust for then? Because a lot of times they, no, I get that.
No, I mean, again, as long as whatever your chosen diet, you should be getting adequate
anyway.
intake.
And you
Yep.
can get adequate vegetarian sources of protein intake.
Yeah.
Yep.
You can.
None of the ones I know, but sure.
Yes. Well, vegan is different.
It's going to be eating a large volume of food.
Just pancakes, pretty much.
Yeah.
Well, no, I mean, in fact, like eggs is one of the number one things I recommend to people after surgery, because it's very high in choline. I mean, eggs are a superfood. So vegetarian or not, like eggs are absolutely something you should be consuming after surgery if you can tolerate them. Yeah. So great question. I appreciate that one. All right. So from Mr. Blaze, 187.
I love
from
this guy's name already.
Liposuction myths. Mr. Blaze asks, I got a gut and love handles as a kid and they won't go away. Is lipo the best solution?
It depends. In a lot of cases, it can really, really help
It's a
lot.
good solution.
If you've had them since you were a kid and you're middle-aged and you now have a lot of loose skin, in that case, the tummy tuck may be the answer. It just depends on your clinical exam.
Tummy tuck with lipo.
Yeah.
My one question with this, I mean, with men who tend to carry their fat more inside, like around their organs versus the subcutaneous fat, that would be something that like even a tummy tuck and liposuction is not going to get rid of that internal fat.
Right. So visceral fat is the real problem in men and women too, but in men, if you have that kind of, I don't know what they call it, like a beer belly, that's what we call pot belly growing up. I don't know what the word is now, but that really protuberant belly, that can be a warning sign for fatty liver, warning sign for cardiovascular disease. It's really kind of a bad problem. So you can do liposuction and help some with the way your belly looks and your flanks or the things that hang over your pants, but it's a drop in the bucket to what you really need, which is weight loss and a lifestyle change. But if you are checking all the boxes, you don't have a lot of visceral fat, which is that internal fat, how would you know if you have that or not? How would Mr. Blaze know if he has visceral fat versus external fat? If you bend over and you can grab all the fat that's there and everything else seems pretty good below that.
Flex real hard and then do it.
Yeah.
Yeah. Like that for me is like if you flex and like that fat just doesn't even move.
Yeah.
Like, yeah, it's probably a good indication that it's
so
it's
Mr. Blaze, if
that.
you have that, then, liposuction would offer you a lot of improvement. And we do that on men on a regular basis.
Especially on the flanks, the love
So
handles. Oh man, it's like, even with a tummy tuck, we'd still lipo your love handles. So yes.
Yeah.
So to me, I think yes. Is lipo the best solution? It's probably one of two.
Most men, even like in Nils's weight class or mine, which is fairly lean, the flanks are you could liposuction the flanks on someone like Nils or I and get a good result. So most men need liposuction of the flanks, period.
Well, most people.
Yeah, we hold weight there.
Women too. Yeah. They don't like stuff hanging over the back of our waistbands. Yes. Yeah. So Mr. Blaze, get your lipo.
Let's go, Mr. Blaze.
Yes.
187.
187. I know Mr. Blaze. There are sometimes, man, people's usernames. I'm like, how did it get to here? I mean, like
187 is a murder, right? I mean, that's what a 187
dial 187. Yep.
Yeah.
Mm-hmm.
I mean, it is. Mr. Blaze, he's got some stuff going on. You don't mess with Mr. Blaze. I'm Mr. Blaze's friend.
Well,
That's
so
the enemy.
Dr. Martin, you like usernames being what they are. Like, how? I'm not going to say your username because I don't want people to find you. But like, how did you get that? Because it's also an unusual kind of rap style thing.
Yeah, well, it's really not. So in 1997, I was in medical school, and one of my best friends was actually in medical school with me, and he created a Hotmail account. And I said, "Will you create me one?" And he gave me that name, that handle.
He did that from song lyrics, though. I mean, like,
well,
you know what that means, right?
Yayo is whatever. I'm not going to say the full thing of it, but like I know what that is. But the other part of it was actually a receiver for the football team.
Right.
So he combined them together, and that was my name. And back then, I was like, "That is like brilliant. That's so awesome, dude! I love this."
He was the original Benifer.
Yeah,
he was combining words.
But now, like after using that like screen name, I was like, I wish I would have like done something more age appropriate for middle age,
like for an adult man.
Yeah.
I mean, honestly, the first time I read it, I was like, okay, because
I just did this with some of my friends. Some of my friends recently. We just what was your like AOL? Your AOL name and everything.
Your chat name.
Yeah, your chat name, and it's amazing. Like there's no one who isn't full of shame by admitting.
Yeah, I know. Well, I mean, the worst part was I didn't even create it for myself.
That is good.
It was created for you. Well, it was like we had an esthetician whose dog was named Doja.
Yeah.
Like the sticky Doja.
Yeah.
Nice.
Yeah. Yeah. All right. Well, we're going to take a break.
And that was pre-Doja the cat.
Yes.
Yeah, it was pre-Doja the cat, but it was post-Dre Doja the song.
Yeah.
Yeah.
I don't even know that song. Is that Drake?
Got the sticky icky icky. No, it's before Drake. Yeah. Yep.
Yeah.
Yep.
Okay.
All right. Well, we're going to take a break. and we'll be back. We're back.
We're back.
All right. Part 2 of part 2.
Yep.
The doo-doo. All right. So this one is from Everything You Need to Know About Breast Reduction, Part 1, from I Love Romeo 3. I got medical necessity insurance approval for her breast reduction.
Good.
Age 65, done dealing with them. Wore bras 24/7 my whole life, headaches, being teased, pain, etc. Surgery happened last month. It was on April 2nd. Yay.
April's this month.
This is May.
Oh, we're in
Remember?
May. I'm sorry. Yes.
It's gonna be May.
Okay, I got you.
No. So she had her surgery about a month ago.
I'm so happy for her. Yeah.
Yes. I mean, like all these things that we say that, people deal with, like, can you imagine wearing a bra 24/7?
No.
Yeah. And being teased and like having pain and to 65. This is my point about doing surgery. Like, just do it.
Yeah.
And I love that her insurance approved it. I mean, that means it's very significant.
Right. That means she has, what are some of the criteria the insurance says that you have real physical problems?
Well, first that your schnur is high enough.
Yeah.
Like that they're going to remove enough tissue that it's medically necessary. So that first.
And the schnur really equates to, are you moving enough tissue to actually make a physical benefit to you, not just a cosmetic benefit?
Yeah, based on your body weight. I mean, most insurance companies require that you've tried some CAM, which is complementary and alternative medicine, meaning PT, massage, even things like you have bra grooving that you can prove. I mean, if you're on a bra 24/7, like I'm sure you have grooving. Headaches, so any things like that you've tried to treat other ways.
Neck pain, shoulder pain, kyphotic stance. That's a big one. Like the way that you're almost rolling over on yourself.
That weight.
Yeah, and that really can mess with your functionality, mess with your spine, mess with your core. Just makes you have discomfort. You feel bad. And it's like you talk to these people and it's just, they're so inspiring because they're like really resilient. The stuff they deal with, they're like, I just, this is what I did. I wore 3 bras. I did this. I did that. It was really hard to exercise. I would just make it work. I would find smart ways. It was hard to sleep. Some people had a hard time sleeping.
Oh my goodness. One of our patients, we did not do her breast reduction. We did her tummy tuck, but she showed me the picture. She goes, you wouldn't believe it. And I'm like, okay. And she's like, I'm going to find a picture. So I'm going to bring it in. So she came in this week and she showed me the picture and it was up there. I would put it in the top 10 of largest breasts I've seen. And she is not a big person. She's like 5'6". I'm like, oh my gosh. When you're pregnant, I'm like, did your breasts hang over your stomach? They're that big. Like her breasts were like extended beyond her pregnant belly.
That's so crazy.
Yeah. I mean like nuts. So yeah, like talk about like life-changing.
This is one of the most life-changing surgeries you can do. I love Romeo. I'm so happy for you. I'm sure the surgery went well. Please write back and tell us how it went.
Yeah, she's a month out. So I always say the best surgery you had is the one you had 2 weeks ago or 4 weeks ago.
Let us know.
No more bashing boobs.
No more bashing boobs. Oh.
Yeah, that was one of our favorites.
One of our favorites.
Your boobs didn't hit the door going in.
Bash a boob.
Through the doorway.
So good. Congratulations on your surgery. That's awesome. All right. So this one was on our direct excision neck lift. This is from Miss Louise V. She writes, "This sucks. I don't see much difference. You have to show before and after photos and the exact same angle and same lighting conditions. Otherwise, it shows a lot of drinking coffee and chatting. This is tea. We drank coffee once. It was when I made it.
Yep.
You have to have more visuals if you are on YouTube. YouTube is a visual medium, not a podcast. Well, Miss Louise, I will direct you to the name of this podcast. It is indeed Beauty and the Surgeon podcast. So we started as a podcast, which maybe everyone doesn't know. And then we did transfer to YouTube. So we are both. We have some amazing pictures on our Instagram of direct excision neck lifts. And we do use the same lighting as much as possible. Like things are not perfect, but we do show a lot of pictures. Thing is that we are fundamentally a podcast. So we do talk a lot and drink tea.
And YouTube has an official podcast section, so
which is us. Yes,
it's a category.
Are we listed under podcast?
We are
listed under podcast.
We are. We sure are.
I mean, I get where.
I
get where you're coming from, and we hear you. My priority is to get our priority is to get real information out. It's less about the before and afters and trying to sell what we do, and more about you getting information about these surgeries, how to prepare, what to look for, how to recover. What is smart, what's not smart, et cetera, all that kind of stuff.
How not to get lost in the weeds.
And I get it.
People just want to see pictures.
They want to do the thing, the 15-second TikTok thing. I get it. And there's tons of people out there that do that. So Miss Louis V, I mean,
well,
go hog on that.
We have a short on YouTube that is of a direct excision.
Oh, we do have that, yeah. And that actually is on TikTok too, I think.
Yeah.
And that got a lot of views.
And Instagram.
But we get it. It's just not the medium that we're trying to fulfill here. And it's not going to be.
As the producer, I have to say that this is an educational podcast, and if you're getting your education from a 15-second clip, I would advise you to dig a little deeper.
Yeah. Right.
It's showing our age, man.
Also, don't group on your plastic surgery.
Yes, exactly.
Miss Louise, we appreciate all comments.
I send my son YouTube videos that are very educational. And he's like, I saw that on TikTok. And I was like, you saw 30 seconds of the 20-minute video. Do you know what I'm saying?
Oh, who reads the titles of articles?
Not me.
See, we all. This is a problem. I actually listened to a very fascinating podcast recently that was talking about attention span, specifically related to short form media. Yeah. It was fascinating, specifically about the age that children nowadays start watching them and how that impacts their development over their lifetime is shocking.
You know what's really frustrating? So I love YouTube as a medium, or I did historically, and they've really started to put their shorts more and more and more. So when you scroll down, it's like, it used to be where you could see long form video like 5-8 times. Now it's like 3 long form videos and then all shorts and then 3 long form videos.
You can turn that off, right?
Oh, you can?
Yeah. I have it turned off on my feed not to show me shorts. Yeah.
It's a good way of doing it.
Yeah, because I don't go to YouTube for that. Like I'm on YouTube for long form comment or longer form comment. And one of the interesting things they said that like no one under the age of 18 should ever watch a video that is less than 10 minutes long. And he talked specifically about why it was really interesting.
Well, that cat's out of the bag.
My youngest nephew is like, I just really want to learn how to watch stuff for longer so I can get through a movie. And I'm like, oh, you poor buddy.
Yeah, I know.
Well, they're even, so this is a thing now that writers are doing. They're actually writing the scripts for TV shows in a way that they know people are looking at their phone.
Yeah.
The whole time.
That's all Netflix is programming.
Yeah. That's what Matt Damon said. Like, he says you're supposed to tell the whole story twice. Basically, that's what Matt Damon said.
And if you're someone who can concentrate, you just feel like you're,
right,
you're getting gaslit. Why? You just told me this.
Yeah, exactly. How much exposition do we need here?
Right. It's literally meant to be listened to while you're on your phone.
We like actually negative comments. I actually really enjoy it. So just so you know. So thank you. Also,
we do stay well hydrated.
We do. We stay well hydrated. But the great thing about the internet, and I tell my patients this too, is that there's a lot of stuff out there.
We're not for
everyone. You can find
everyone.
whatever you want. If you wanted to see a direct excision neck lift with like hyper edited, all the cuts, it's out there, and I could literally make that. I just choose not to.
We have a full video of a direct excision neck lift on our YouTube
with me.
Yes,
with me talking.
Yes.
Yeah.
Like full surgeries.
Hey man.
And you know what? We don't call those videos podcasts.
That's true.
Yeah.
Okay.
So they exist. So
cool, man. But thank you for the comment.
Yes. Next one, we're back to everything you need to know about liposuction part 2.
Oh, I wanted more hater comments.
This is from Narishna Frazier. I had a tummy tuck last year. It was a very hard recovery, but so worth it. I'm thinking about getting 360 lipo. My surgeon did lipo on my stomach, but there is more on my upper abs and around my trunk. I'd like to take off. How does this recovery compare to the tummy tuck? I'm telling myself if I could do the tummy tuck, I can do this. Narishna, I will tell you this. If you did not have lipo at all, she said a little bit on her stomach, but there's more. Your 360 lipo recovery, you might think is worse than your tummy tuck recovery.
That's the truth.
Yep. Because it's going to be different type of pain, but you are correct. If you get through the tummy tuck, you can get through anything. So this lipo will hurt, but it will be worth it. Just like the tummy tuck was worth it.
And that's why, just FYI, with tummy tucks, I tend to do 360 lipo pretty much universally, or a lot of lipo.
Well, except for the upper abdomen.
Except for the upper abdomen.
And that's where she said there's more, which yes.
Right.
And
it's hard to do that with tummy tucks because you can have blood supply issues, then healing issues, wound issues. It becomes a real problem. So you tend to stay away from that. And that's not unusual. We'll come back and liposuction secondarily, but
we usually tell our patients that ahead of time. Like you will still have some fullness, especially around the ribs.
Yeah.
And we just go back in and lipo it 6-8 months later.
Yep.
Yeah. So yeah, you can do this. So everything you need about liposuction is a great one to listen to. Also listen to liposuction myths. And we have the Reddit response, things I wish I knew about liposuction right now.
Here. That's a really good one.
Yeah.
This one right here.
Yeah. It has some really great tips on recovery, like even more than we talk about in this episode. So that one I definitely recommend listening to. Yeah, you can do it.
Let's go.
It hurts, but you can do it. You'll turtle. Oh my gosh. I haven't, I kind of told Nils this. So when I was at the Arnold, the woman that came up to me, this is a great story. So she was a listener of the podcast, and I do a bodybuilding podcast, and I was at a bodybuilding show. So when she came up to me and she's kind of looking, and she goes, "Are you Amy from the podcast?" And I'm like, "Yeah." And I was assuming she was talking about my bodybuilding podcast, because again, we're at a bodybuilding show. She's like, "Oh my gosh, I've watched all your episodes," and she said something to Dr. Martin, and I'm like, "Oh my gosh, you watch Beauty and the Surgeon." And her husband's standing there, and they take a picture with her. She said that after she did her mommy makeover, her husband bought her a turtle, because I always say you'll turtle.
Yeah, you'll turtle. That's cute.
So and I'm sorry I didn't ask your name, but if you are listening to this episode too, just know that was the highlight of my trip to the Arnold.
And the husband's a sweet guy.
Yes, your husband is awesome. I love that he bought you a turtle.
That's nice.
So cool.
Mm-hmm.
Yeah, that's nice.
Yeah. So sorry, the tangent there, but
yeah.
See, you can get through it. You'll just turtle for a while, but you'll be fine.
We have fans everywhere, even in Ohio.
Yes. So these next two are from Dr. Martin's post of his shamrock shake. So this was a YouTube short. I posted the picture you sent us as a YouTube short on St. Patrick's Day. And this one's from Christy Christ. I always want to say Christy, but it's Christ is King.
0919.
0919.
Yeah.
I thought of you when I saw the window advertisement for it in town. Family traditions are important.
Oh, definitely.
With a green heart.
Yeah.
And they are. And that's the whole point. And I say this all the time. I am a nutritional therapy practitioner. And people think I'm this food crazy person and would tell someone not to do that. I would tell you that if you don't do that with your family, that's way worse.
Yeah, you're missing the point of it.
Exactly.
Yeah. And if we're being honest, I mean,
one meal.
We're a super healthy family, or at least my wife and I are. My kids are young, but we would only go to McDonald's once a year for this, and it made it so fun. The kids were so excited. Now I'm sure they went with their friends, but like, you know, us as a family, and that we would get it. And even on St. Patty's Day, I was sharing those pictures with my kids who are now like off to college.
Yes.
They went to McDonald's where they were and got a Shamrock Shake.
Yes. And that's what's important, you know? And like I always tell people, like, you're going to eat again. Like this was one choice. And if you listen to our episode about the things that you can do to make you look younger, no knives or needles required.
A Shamrock Shake will make you look younger.
Well, no, it talks so much about balance in your diet, and that the people who actually look the youngest and live the healthiest, longest lives have balance in all things, and that includes in their diet.
Right.
They are not overly restrictive.
Right.
Yes.
Danielson.
Yeah.
Yin and yang.
So this next one was also on this. This was from Monica Straub, our friend. Wow, you do you, but honestly, looking at that is making my stomach cry a little. Yeah, not everybody can do dairy.
I'm sure the dairy, and then you throw in some like McDonald's fries.
Yeah.
Mm-hmm.
Yeah.
Well, and if you're at all lactose intolerant, like, that's going to make your stomach cry.
And I don't even think the fries are gluten-free, actually. I don't know that.
Yeah. I mean,
I'm not a gluten-free person.
If your stomach doesn't tolerate dairy, I can understand why that would make your stomach cry. I mean,
I get it.
Oh gosh, like when I see like lattes at Starbucks, I'm like, oh, I bet that's good, but like that would literally kill me.
Yeah.
Like I would be dying.
But it would taste good going down.
Oh my gosh, it would. And they make all these fun things with like the cold foams and stuff. And I'm like, oh no. Would not work for me.
I do okay with dairy, but something that sweet will still make my tummy cry.
Yeah.
Like, I'm just like, oh my gosh,
it is
that
sweet.
was a
too sweet.
lot.
Yeah, I don't drink the whole thing.
Yeah, it was a small one too.
Yeah.
That's why I like the fried dipping. Like if someone else has a shake,
Let's just be honest. I do it for the fries. I'm just not even gonna joke around about it.
Fries are good.
Yeah. So that wraps up part 2.
That was awesome.
Of listener questions and comments.
I like more hater questions too. We want to get it all. That's user engagement. That's good. Yeah. Algorithmically, it works, you know.
Right. A comment's a comment.
Yeah.
Yeah. And like I said, I mean, yes, like we like constructive feedback.
Yeah, it's good.
Yes. Like we're not above reproach.
No.
Like we can be better.
We're open to it.
Yeah, we can be better. All right, Dr. Martin. Well, you are off to gallivant the world.
Yes.
We'll be back.
That's just what I do. I travel the world and I do high-end surgery.
Yeah.
And then I podcast.
Can you imagine if we had a plane with an OR in it? How awesome that would be.
Oh, that would be great.
People would just come out to the tarmac and we'd load them into the plane, do their surgery, and then fly off to the next location. No, that's what we'd land. Bring the patients. They come to the airport. We do the surgery and then roll them off.
And then we'd go on to the next place.
Roll them down the slide.
Yeah. It reminded me of Airplane for the second.
Yes.
Girls on the little girl.
Yeah.
Oh man, the last flight I was on, there was actually a couple little girls getting on in front of me, and they got the card.
Yeah.
The pilot brought them out the little card. It was very cute of the plane. It was really cute. Yeah. Cuteness still exists. All right. Well, until next time, if you want to be on the next episode of Listener Questions and Comments, you can leave me a voicemail, which are always fun, or you can send me a text.
What's that number?
Like Amy? Our 2 anonymous texts, 303-630-9038. You can also find all of our social media handles here and link below. And we'll see you all here next time.
Thank you so much.